child's anxiety is beyond age appropriateness. So an example of that is a child who has separation anxiety between the ages of 1 to 3. We know that this is age appropriate, developmentally normal, but when a 9 or 10-year-old is having a difficult time transitioning from caregiver or a teacher, there may be cause for concern to have something like a separation anxiety disorder. Distress. So the child will experience a great deal of distress in comparison to their other peers. So this child will find things more stressful than their other peers. They may be anxious more of the time. They may just look stressed on a daily basis. And the length of time. So if the child has experienced consistent anxiety for several weeks to 6 months with significant life interference, this child may be experiencing an anxiety disorder. Yes?
What's the age group that they start feeling the anxiety?
So like separation anxiety disorder can start as young as 2 or 3. So toddler age, preschool age, even actually babies in the infant room. So even as young as 1. Yeah. Okay, so I'm going to go into the different types of anxiety that children can experience. So the generalized anxiety disorder is basically an excessive anxiety or worry about pretty much anything and everything. So this child may be worried about school performance, family relationships, or extracurricular performances. A child with this diagnosis may experience the following: so fatigue, irritability, difficulty concentrating, sleep disturbances. So generalized anxiety is basically everything is making them anxious. Like, not everything, but most things will make this child anxious. So it doesn't really have a specific thing that triggers it.
So it's like,
Yeah.
it says sleep disorders.
Yeah.
When you're at night time, or something like that, you're always.
Yeah, like the child is not able to like fall asleep, they're not able to come down and relax, right? It doesn't mean that they're having anxiety, but those are one of the symptoms. There usually will be other symptoms associated to consider it anxiety. But yeah, they won't feel, it's hard for them to sleep at night. It's hard for them to fall asleep or stay asleep during the night or at that time. Yeah. Okay, and separation anxiety disorder. So I feel that this is probably the one that we will experience most often in child care centers because we are dealing with children leaving their caregivers on a daily basis. So some separation anxiety is developmentally appropriate and also quite common in ages 1 to 3. So children older than this that have an excessive fear or anxiety resulting in a caregiver leaving could qualify for a diagnosis of this disorder. So these children will refuse to go to school, they often have nightmares, headaches, or nausea, and these can all be symptoms associated with this disorder. So they have that fear of mom leaving, or grandma leaving, or whoever is bringing them to daycare, whoever is bringing them to school, and they're older than the age 1 to 3. They're 4, they're 5, they're 6, they're 7, and they, it's almost like they don't know that that person is coming back, so they have an anxiety about someone leaving them. Okay, I have a little YouTube video called Tom the Worry Dragon. So it's a little cartoon video to kind of give you a better understanding of what separation anxiety feels like for a child.
I don't know if this is right. Oh, jeez. Wait, she's going? We'll never see her again. Oh, jeez. Oh, jeez. That won't do you good. She can't hear you. Why did she stop feeding us? We're out of food. We're never gonna eat again. Mama! You don't have the flu shot. Only Mom will protect you.
Go have fun, Tom.
Oh, jeez, don't.
Hey,
Don't play. He will laugh at you. Or don't. First day of school. You're never gonna come back.
Please don't leave me.
It's gonna be okay, love. School of death, I tell ya. School of death. Oh, gee.
I'm too young to die.
What?
I have a stomachache
You do? Oh, my head.
and a headache.
Oh, my beautiful boy. She called you beautiful. Everyone is gonna laugh at you. Oh, jeez. Are you afraid?
Yeah. W says I'll never see you again.
Oh, well. Is W a big, fast car gonna run you over? Honk, honk.
No.
Oh, well, then he must be a big tornado gonna blow you away.
No.
Oh, well, what is W?
My worry dragon.
Oh, so all those fears you have belong to your worry dragon.
Uh-huh.
So they're not your fears at all? They belong to him?
Huh. I guess.
So there isn't really anything for you to worry about.
Hey, my stomachache is gone. Cool. No, Mom. I guess there isn't.
Go on, have fun. I'll see you later after school.
Hey, you want to play soccer baseball with us?
Yeah, I would.
Oh, jeez.
Okay. So I hope that gave you a better understanding of what it's like, right? So those are the things that are going on in this child's head. Not all of them, but things like that. Worry that mom is going to not return, she's not going to come back to feed me. So that's kind of what they're thinking in their head. Sorry. Okay. So selective mutism is actually a new one that I learned while I was doing my research. So this is basically a refusal to speak in certain social settings. So these children are often quite talkative and comfortable, and at home or wherever they feel comfortable. They may refuse to speak at school and lack eye contact. Children around the age of 5 are usually diagnosed with this disorder. And the reason that is that around 5 they're going into JK, SK, and the expectations in the school system are a lot different than in childcare. So we do expect children of that age to engage in conversation with their peers, to answer questions and to sit at circle and to kind of, be interacting. So when we find that a child is not speaking or very rarely speaking, then there might be reason to look more into that, right? Because children at that age, they don't have, for the most part, they don't have that fear of I'm going to say something wrong or, so if they're not speaking, then there may be something else going on. So this is a child who does talk at home, who does talk to people they're comfortable with, so they are able to talk. It's not a speech and language issue. It's just that they become mute, basically, when they're in situations they're not comfortable in. So I know that it happens for adults as well. Like some adults, people, are more nervous in situations they're not comfortable and they get scared to talk. They get scared to raise their hand or answer questions, right? So we all experience a little bit of that. Yes.
Just have a quick question.
Yeah.
In regards to the separation anxiety
Yeah.
disorder, if you have a parent, because in childcare environment, sorry.
Yeah, it's
I have a parent, if we have parents that come in and you see that the child is having separation anxiety,
Yeah.
and we don't call it disorder,
Yeah.
because that word alone scares parents,
Yeah,
so something is wrong with their child. But how would you then explain to a parent, or support a parent on how to get that child out of that? Because in past experience for myself, I've seen parents take children out of daycare because of something they're doing at daycare, not knowing that a child is
Yeah,
having
definitely.
separation anxiety, because child is having nightmares at home.
Oh, right.
Same symptoms that you just mentioned, the dragon, which is a perfect video, which you can share with parents too as
Yeah.
well. But what else can we say as child or adults in that environment to show parents on how to help that situation and not put that fear into them too? Because that separation anxiety is already there for the child.
For
And
sure.
the parents
The
thinking
parent is
something is going on in
yeah.
childcare where the child's not feeling comfortable. So
Exactly.
what can we do as the
Professional,
professional giving advice to that parent?
Yeah, so I feel that because we're not diagnosing ever, right? So we're gonna kind of explain to the parent that these are things that happen. Is this a child who's already transitioned, or is this during the beginning of the transition period?
Well, that's the thing. This child has came twice, but first in
Oh,
toddler
yeah.
and child was having a really hard time.
Right.
And parents have been out, so they really not ready. We said, okay, no problem.
Yeah.
You know, just try different things, take them to different programs.
Yeah,
and on all those
getting more
different things.
exposed,
Right.
yeah.
So then it came back to preschool. So the child now has words now. So now she was in care for maybe a month and a half. And mom says she's having nightmares and stuff like
Right.
that. So we said to mom, you know, mom's having anxiety too as well.
Yeah,
so we see it in
word.
mom. But we know it's an anxiety
Yeah.
that she's having. But mom is just thinking something is happening in care. But she's to go to school in September now. So we're trying to support mom, even though she's not part of our child care anymore.
Okay.
But we don't know what else to give her. Like this video I can
Yeah, so
share.
you could share things like resources, videos are a great thing. There's books out there on separation anxiety that you could offer the mom to have a look
Language is a
at.
barrier too, that's why I
Oh,
was
okay,
saying
yeah,
that.
so that's difficult. The vet, do you have a resource consultant on site? Like, do you work with a resource consultant?
Not on site, but we can.
But you can access one, yeah. Okay, so at that point, if the child is showing like excessive fears, I would probably ask the parent if they're willing to work with a resource consultant, because that is basically your best bet. That is the professional that has all of the connections to outside resources. And I mean, sometimes parents are a little hesitant on that as well, because they think that my child has to work with someone different, right?
Yeah.
But it is definitely something worth talking to her about. If you have a relationship with her, explaining to her that resource consultants are there to help, and maybe she has some suggestions to help with the nightmares. Parents want help. They want to sleep at night. They don't want their child to be experiencing anything. So if you give her a sense that this person can help you with strategies, which resource consultants will do, that is probably the best bet, I would say, because you guys have tried things at the center, right? So, and then videos like that, books, I know the language, yeah.
Yeah, so one thing that like I've done in the past with children who like, if I drop off, they're having like a really difficult time and throughout the day it gets better,
Yeah.
I'll give the parents a call like in the middle of the day and just say, I just wanna let you know the day got a little bit better, this
For
is
sure.
what we're doing at that point, and then that also helps the parents, so they're not sitting there all day thinking, oh, I wonder how my child is doing, I hope they're a little bit better, because it gives them that little sense of like it takes away that little bit of worry.
Yeah,
Yeah.
because we have a story park at our
Yeah.
location, so we do videos and tapes and everything
Yeah.
to parents. Child's having an awesome day.
Yeah.
Child, the transitions even fine too. Because when she goes home, because she wants to stay home, she wants mommy to stay home with her. So she's making mommy feel guilty.
Yeah.
But she's perfectly fine throughout the day. She talks, she interacts.
Yeah.
She's perfectly fine.
Oh,
But it's going
yeah.
home at nighttime. Mommy's like, and she'll call the next morning like 10 times, like, did she have a good day? I said, I'm like, yeah, we should do videos and stuff like that.
Yeah.
And I'm like, if you want to, you can stay too and see how she interacts with
Yeah.
the program. But it's just at home is the problem.
Yeah,
Yeah.
it's difficult.
Yeah.
Yeah, those type of things though, like, you know, I was gonna say transitional objects, like if there's something the child, but if she's fine in childcare, then yeah. So I would probably like ask the parent if she's open to speak to a consultant, because consultants can refer them to the appropriate sources, right? Yeah, that's a good question though. The next one is specific phobia. So these are children that have an excessive fear of certain objects or situations. It is when these fears become excessive or the fear of danger is out of proportion to the danger imposed that we classify this as a phobia. So these objects or situations can cause the child to cry, freeze, or cling to a parent. Some of these phobias include storms, needles, loud sounds, and enclosed spaces. I know that this one is like for like many of us. Like, I don't know, elevators sometimes freak me out, like they're not gonna open up or something, right? So imagine being a child and not really understanding that there is help if that situation happens, right? So, yeah, this is quite a scary one for the children that experience it. Okay, panic disorder. So a child who has reoccurring panic attacks or has a fear of having them may qualify for a diagnosis of this disorder. So a child having a panic attack may have some or all of these symptoms: shortness of breath, chest pain, sensation of choking, nausea, dizziness, chill or heat sensations, fear of going crazy, and fear of dying. So it is important to remember that with panic disorders, not all of these symptoms happen at once. They can happen, all of them at once, but sometimes it's just that the child feels pain in their chest or has they feel dizzy, or they feel really hot, or they feel really cold. So it doesn't always mean they're going to experience all of these things at once. And it's when they're having them, their reoccurring panic attacks, not if they've had it one time and then a few months later another time. It's like a constant thing that's happening in their life that we would maybe think that this is what they could be experiencing. Okay, so social anxiety disorder is also one that I feel we will come across a lot in childcare centers. So this is an intense fear of participating in class or interaction with peers. So children with this disorder may have the following: tantrums, crying, clinging to adults, freezing up, or refusing to speak, and may avoid social settings. So this is a child that, you know, they're not able to make those relationships with other peers in the room. It's hard for them to make friends, and they feel fearful of things that they may say. They feel that they may say the wrong thing. So it is really hard for these children to make friends. Sorry about that. So yeah, this is social anxiety disorder. Okay, body focused repetitive behaviors. I actually didn't know that this was considered an anxiety disorder, but it is. So a child with this disorder engages in excessive habitual behavior such as hair pulling, skin pulling, nail biting, nose picking, and lip or cheek biting. So this can actually result in noticeable hair loss and skin abrasion. This behavior occurs despite extensive efforts to stop the behavior. So this child is pulling their hair out, so you can actually see bald spots.
We actually had a child in our center in our toddler room, and every day at nap time she would pull out chunks of her hair. And she'd wake up and you would find chunks of her hair all over her cot.
Wow.
And that was extremely challenging
Yeah.
with that, because like we didn't know how to handle that as well. Like that was, we ended up just ending up having to sit with her at nap time and like comforting her to get her to sleep so she wouldn't pull out her hair.
Yeah.
It was,
Well, we had the same issue with the little boy, and the parents' solution was just to put him, so he would always wear a hat
Okay.
because it was during the transition time.
Yeah.
All the time from playing, to tidying up to go outside, or from outside to coming in, because at transition times, he would just pull at it.
Yeah. So those were times that made him anxious. So that was the way he dealt with
Transition time.
it.
So
Yeah.
parents' thing was, so we had like a little tool that he worked inside the classroom, so he would try to avoid him not pulling at him.
Right. Okay. Yeah. So that's like the bottom sentence where it says that it still occurs despite efforts to stop it. So you guys probably know that people who bite their nails, there's like stuff that you can put on the nails, right? So these children are biting through that. So trying to get them to stop and doing different things is not working, right? So. Okay, obsessive compulsive disorder, also known as OCD. So children do experience this disorder. So these children have obsessions or unwanted thoughts that cause them to engage in repetitive behaviors and attempt to ease their anxiety or discomfort. So examples of this are obsessive hand washing, tapping, checking, or mental routines such as obsessive counting and organization. So I have a short little video. I think that everybody has not necessarily OCD. We don't want to, there are severe cases, but we want things to be organized, right? But this is when it's excessive. So this is things that disrupts their daily functioning. Okay. Is the volume okay?
Yeah. It can be obsessive thoughts and repetitive behaviors. Children with obsessive compulsive disorder can be